Maybe there are maybe there are no guests today.
We do have plenty of guests.
We'll have it. It'll be
Thank
private.
you. And they're just coming in. And fantastic. Welcome everyone to Afternoon Tea with Docs. I'm Dr. Linda, emergency medicine physician. I'm from Sheffield, and I'm here with my lovely co-host, Dr. Erica, who is a GP from the West Midlands. And we are both lifestyle medicine physicians. If you're new here, please introduce yourself. Let us know where you're zooming in from, and leave us comments in the Zoom chat or on live on YouTube and Instagram. Well, cardiovascular disease is the #1 killer in the Western world, but it doesn't need to be that way. The truth is that more than 75% of cases of heart attacks, strokes, and other cardiovascular diseases are preventable. And Dr. Caldwell Esselstyn illustrated that a plant-based, oil-free diet can not only prevent the progression of heart disease, but can also reverse its effects. We host afternoon tea every single Sunday at 5 p.m. UK time, where you can connect with world-renowned experts, and we share 3 actionable takeaways that you can implement in your life right away to start achieving your health goals. You can chat directly with our guest experts here on Zoom, or follow us on live stream via Instagram, Facebook, and YouTube. If you're ready to implement your lifestyle goal, join our free membership on our website to be part of our supportive community to set you up for success.
Somebody there from Seattle.
We are focusing on metabolic diseases in May and June, and today we're so honoured to have one of the most esteemed figures in plant-based nutrition join us for afternoon tea, and he needs no introduction, but we're going to introduce him anyway. Dr. Caldwell Esselstyn received his AB from Yale University in 1956 and his MD from Western Reserve University School of Medicine in 1961. In 1956, he received a gold medal in rowing at the Olympic Games, and in 1968, as an army surgeon in Vietnam, he was awarded the Bronze Star. He was trained as a surgeon at the Cleveland Clinic and has been associated with the Cleveland Clinic since 1961. He was president of the staff and a member of the Board of Governors. He was chairman of the Breast Cancer Task Force and head of the section of thyroid and parathyroid disease. He is a fellow of the American College of Cardiology. In 2005, he became the first recipient of the Benjamin Spock Award for Compassion in Medicine. He received the Distinguished Alumnus Award from the Cleveland Clinic Alumni Association in 2009. And in 2013, he received Yale University's George Herbert Walker Bush Award for Lifetime Achievement. In 2016, he received the Case Western Reserve Medical School Distinguished Alumni Award. Dr. Esselstyn has also received the 2015 Plantrition Project Luminary Award, the Case Western Reserve University School of Medicine 2016 Distinguished Alumni Award, and the American College of Lifestyle Medicine 2016 Lifetime Achievement Award. His scientific publications number over 160. His pioneering research is summarized in his best-selling book, Prevent and Reverse Heart Disease. In July 2014, his study of 200 patients confirms an even larger group can be adherent to plant-based nutrition and achieve the same significant arrest and reversal of disease. Currently, he directs the Cardiovascular Disease Prevention and Reversal Program at the Cleveland Clinic Wellness Institute. Welcome, Dr. Esselstyn.
Welcome, Dr. Esselstyn.
Thank you, Linda. Thank you, Erica. I'm delighted to be with you.
We have heard all your numerous accolades, and we would just love to know, how did it all started in 1933? Who was Caldwell Esselstyn Jr. before he decided to become a doctor?
Well, I was born in New York City, but I grew up on the family farm in upstate New York. It was cattle and dairy were the primary focuses of the farm. My father actually was a general surgeon, and it was in I went to Yale University, and it was in my third year there that I decided if I didn't try to go to medical school, I would always sort of, believe it or not, I would sort of feel I would have regretted it. So I did apply, and I did go to medical school. And after medical school, I went to the Cleveland Clinic, where I got my training and residency in general surgery. After I finished a residency in surgery, I was 2 years in the United States Army. And the second of those 2 years, I spent a year as a combat surgeon in Vietnam. When I returned from the service, I was offered a position in the Department of General Surgery at the Cleveland Clinic. And in the late 1970s, when I was chairman of the breast cancer task force, I became increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And this led really to a sort of a global review. And it was really quite striking to see that there were multiple cultures where breast cancer was 35 and 40 times less frequent than in the United States. And in rural Japan in the 1950s, breast cancer was very infrequently identified. And yet, as soon as the Japanese women would migrate to the United States by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterpart, and perhaps even more powerful, was cancer of the prostate. How many autopsy-proven deaths were there in 1958 from prostate cancer in the entire nation of Japan? 18. The most mind-boggling public health figure I think I've ever heard. So somewhere along with this review, it became apparent to me that there were multiple cultures where cardiovascular disease was virtually non-existent. And it seemed to me that if we could somehow get people to eat as they were eating in these cultures, that this would protect people from having heart disease. And at the same time, it would markedly diminish the likelihood of their having the common Western cancers of breast, prostate, colon, and pancreatic. And so with that information, I then was able to put together the first small study of patients seriously ill with cardiovascular disease, where I wanted them to try to eat as we saw in those cultures where the disease was virtually non-existent. And then in essence, whole food, plant-based nutrition. Now, I had all my surgical duties that I was still responsible for, which is why the study was small. But nevertheless, it was really rather powerful. Now, my concern was, how do I get these patients to comply? Because this is a very significant nutritional change from what people are used to eating in the Western world. And for that, I decided to use the same mantra that I used for my cancer patients, which I had learned many years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Dr. Dunphy used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years of the study, I was seeing these patients every 2 weeks in the office. We would check their cholesterol, their blood pressure, their weight, and I would go over every morsel they ate. At the end of 5 years, I got a little bit more courageous, and we strengthened it out to once a month. Most cardiologists see their patients twice a year. By the end of a decade, they were pretty well on autopilot. So I now stretched it out to seeing them quarterly. And then at the end of 12 years, we summarized that small study and wrote it up, which makes it, I think, one of the most, if not the most, long study of patients of this type. 12 years is almost a half a career. So that's where it stood. And then we began to see these very exciting results. But not only were we able to halt disease progression, but we often saw significant elements of disease reversal.
Incredible. And I believe after you have seen the results, you yourself went on a plant-based diet, oil-free.
No. Before we ever had results, I would never ask the patients to eat this way. Ann and I ate whole food plant-based nutrition. I should tell you the story on that. I knew that we were going to do this study, but I knew that I had to do it myself. I was a cholesterolholic. I mean, I'd grown up on a beef farm and a dairy farm. I loved all these terrible foods. My father had his first heart attack when he was 43. So it was really rather challenging to me. When was I going to start? And if you understand about lifestyle change, there are about 4 or 5 phases you go through, from pre-contemplation to contemplation, action, maintenance. Well, I was probably over here somewhere around contemplation when I just knew I had to do this study. And Ann and I were at a surgical meeting in New Haven, Connecticut. And I can remember it was a terrible weather, and the conference was really rather boring. But they always have a banquet after these conferences. So at the banquet, this waitress put this plate of roast beef in front of me, and it was so large, it was draped over the side of the plate. That's when I said, no. And Ann looked at me and said, "You're not going to eat your roast beef?" I said, "No." She said, "Well, then I'll have it too." Now, Ann's mother had died of breast cancer at age 52. 2 weeks after that, 2 weeks after that conference, Ann's sister came down with breast cancer. She looked at me and said, "I'm with you." So we got into this. And after a year, when our numbers plummeted, I knew I was ready. And so in July of 1985 is when we started that first small study.
Congratulations for taking the dip. And it definitely had to be something that you do together as a family.
Pardon?
It definitely had to be something that you do together as a family for the maintenance part of making this a success. And what changes did you notice in your well-being at the time?
Well, you have more energy, and I somehow I felt protected, because here I was, with a father at age 43 who had a heart attack. So obviously, you could argue that I was somewhat predisposed, and I had the same vulnerable genetic profile. So it was important, if we're going to change this genetic expression, there had to be a significant change. And I think that I was really quite confident that by eating this way, that I didn't want to protect only myself. Mm-hmm. I wanted to protect other patients who were similarly vulnerable.
Mm-hmm. And your cholesterol levels really drastically have dropped. I believe at the beginning it was 185 for you, which is 4.8 here in the UK. And then 2 months later, it dropped to 155. Then when you gave up oil a little later, it went down to 119 without any drugs. Is that correct?
That's right.
Here in the NHS, the general guide recommends that total cholesterol levels should be around American 190 at a level 190, 193 or less for healthy adults, and 4 millimoles, so 150 or less for those at risk of heart disease and circulatory disease. what do you think whenever they talk about having too low cholesterol? What is the lowest cholesterol level that we should be aiming for?
Well, I think that over the years, several things have become increasingly important. One, cholesterol is an absolutely essential molecule for all of us. Every single cell membrane of every cell in our body is made up of cholesterol, all right? And that's the basis of our sex hormones. It's part of vitamin D. Cholesterol is made by your liver. It is absolutely essential. If I have 1,000 patients who absolutely perfectly follow our program, there will be some with a cholesterol of 102, 140, 180, 190, 200. Everybody's going to be a little bit different depending upon what is the thermostat level of their liver. That's what they require. Now, what determines heart disease has never been a number. What determines heart disease is what you are eating, that every time it passes your lips, you injure the delicate innermost lining of the artery called the endothelium. It is the endothelium that manufactures a truly magic molecule of gas, nitric oxide. And it is nitric oxide that is responsible for the salvation and the protection of all of our blood vessels because of the remarkable functions that nitric oxide has. Do you want me to go into those functions?
Absolutely.
Nitric oxide is what is protecting us, all right? And how does it do that? One, it keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect you from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaque. So literally, everybody on the planet Earth, whether they're from London, Berlin, Chicago, New York, or Peoria, Illinois, if they have cardiovascular disease, it is because by now, in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck. They no longer have enough nitric oxide to protect themselves from having blockages or plaque. But the good news is this. This is not a malignancy. This is a completely benign foodborne illness. And once you can instruct and teach patients who have this disease to never, never, never again pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, then the endothelium begins to recover, makes enough nitric oxide so we can halt disease progression, and we often see significant elements of disease reversal.
And that brings us on to the perfect example of Dawn, your patient from your first study, within whom you have noticed these changes. I believe Dawn wasn't able to get to your office without having to stop multiple times on his walk to your office. But then as he took your course and research went on, you have been informed that Dawn was no longer needing to stop on his way to your office. How did that make you feel to know that he was actually likely reversing his disease at the time?
Well, Linda, you bring up that was a very, very key moment, because that was within about 12 or 15 months of starting our study. And here was a patient who I was so focused on his heart, I forgot all about the fact that he had to stop 5 times crossing the Skyway coming to my office because of this partially blocked artery in his thigh. And it was 10 months after being in the program, he came to me one day and said, you know, Dr. Esselstyn, when I first started seeing you, I had to stop 5 times crossing that Skyway because of pain in my calf muscle. I had to wait for the blood to fill up again. But he said, the last month, I don't stop anymore. So what we had done at baseline, we had done a pulse volume at his ankle. And we don't showing it here, but then 10 months later, we repeated the pulse volume. It was now double. So what it told us, we had now absolutely rock solid, irrefutable scientific data that food and food alone could absolutely reverse this disease. And somebody's going to say, well, wait a minute. What about the statin drugs? Well, this was 1986. We didn't have any statin drugs. And so it has continued. Many of the patients that come through our program, long before they came to our program, they discovered, because of the side effects from the statins, either they got severe muscle cramps, it injured their liver, gave them diabetes, or gave them brain fog. They knew they couldn't take statin drugs. They were in no way precluded from enjoying the similar benefits to those who were taking them.
And this is perfectly shown in your book. If you haven't read it yet, guys, is Prevent and Reverse Heart Disease. And here you can see the volume just in.
That's it. You're getting it. Right on the wiggly line on the left was at baseline, and then on the right you can see it's now double. That was the results after 10 months. Yeah.
Incredible. And your other patient that I would love you to talk about, please, is Joe Crow. Dr. Joe Crow, he was actually a surgeon in your hospital, right, I believe. And we would like to show the angiogram, if we can share the screen. So pictures, as they say, speak louder than words.
Yeah, well, what you see on the left, first of all, let me give you the story. It was in 1996, at age 44, Joe Crow began to get some chest pain. But his cholesterol was not that high. Cholesterol was 156. He was not a smoker. He was not diabetic. He did not have high blood pressure. He exercised regularly. He was not overweight. He did not have a strong family history, but chest pain. Finally, cardiology worked him up. They could find nothing. That was in October of 1996. A month later, November, he finished his surgical schedule. He sat down to write post-operative orders when suddenly the elephant was sitting on his chest, pain in his left jaw, shoulder, arm. He was having a heart attack. Whip down to the catheterization laboratory, start the catheterization, cardiac arrest, resuscitate, finish the catheterization, one more cardiac arrest, resuscitate. Then he's stabilized, sent up to the floor. 3 days later, he's discharged. But he's very disappointed because at the time of his catheterization and angiogram, now if you will show that picture again, I'll describe it. The picture you see on the left is the main artery going to the front of the heart, and the entire lower 1/3 outlined by that bracket clearly shows how moth-eaten and diseased that was. And it was diseased over too long a segment. You just cannot ram in stent after stent after stent. It was too far down the artery for a bypass. So he felt that they really hadn't done much for him. So 2 weeks after his heart attack, Ann and I had Joe and his wife out for dinner. Joe, come on. You've been eating this horrible Western diet. Really, I think you ought to give it a chance. We have 10 years of data. Why don't you think about going plant-based? And he said, well, they really couldn't offer me anything else. I'll be happy to be plant-based, but I'm not going to take any of those statin drugs. I don't trust them. There are too many side effects. Fine. That's your call. Well, he became the absolute personification of commitment to whole food plant-based nutrition. And over the next 2.5 years, his total cholesterol plummeted. His LDL cholesterol went from 98 to 38. Then he finally had, at 2.5 years after his heart attack, he had another catheterization, an angiogram. And you can see on the right, it's gone. The blockage seems to be gone. Now, this isn't going to happen to everybody. However, when the patients are young, and when the patient is young and the plaque is made up of inflammation, fat, and cholesterol, the body has a strong capacity to reverse this. However, in the older patients where the plaque or blockage has been there for decades, it may very well be that that is now made up of fibrosis and scar and calcification, and that doesn't go away. And yet, nevertheless, even those patients can get back to full activity without restriction. And I don't know if you, I don't think you probably have a slide where I show all the vessels of the heart when there's no muscle. But anyway, if you want, I will try to explain how that works. Not now, but later on.
Sure. That one?
No, it's not. It's not in the book. It's only in a talk that I give. Yeah.
I'll send it.
Maybe Ann. Actually, I think Ann may be able to send it to you right now.
Sure.
Yeah.
Shall I show the other angiogram
Sure.
from your website
Pardon?
as well? This one.
Oh yeah. Well, that's if you want. That's another. That is a gentleman who we start on the left. He was 45 years old when he had his heart attack in July of 2017. At the time of his heart attack, you can see where the arrow is that was described as an 80% blockage of the obtuse marginal branch of the circumflex artery that goes to the back of the heart. But he did not want to have the operation that was involved. And he said he would prefer to follow the diet as described in the book, Prevent and Reverse Heart Disease. Well, his cardiologist did not agree. So a year later, he said, we better check that one again. So instead of being 80% blocked as it was originally, a year later, it was now 40% blocked. Well, then he switched cardiologists, and lo and behold, his new cardiologist, a year and a half later, wanted a third angiogram. And if you look now on the one from the far right, the blockage is completely gone. The reason I found out about this is that the patient wrote me a letter thanking me for writing the book, Prevent and Reverse Heart Disease. And at the same time, he then sent the images that I've just shared with you. So it really, what's so profound about that case, there was not a single doctor who was advising him to treat the causation of the illness. And he decided simply to do it out of the book. And it really, I think it sends a very strong message. It should to every physician. Learn how to encourage and show your patients the value of whole food plant-based nutrition, because here you have a treatment where there's no expense, no serious side effects, And the results are absolutely profound.
Yeah, I mean, that brings us onto the point of, as medics, we're taught that poor diet is a risk factor for things like heart disease. But there seems to be a disconnect when it comes to thinking about nutrition as a solution for conditions like coronary heart disease. Why do you think that might be?
Well, there's no surprise, because neither in medical school nor in their postgraduate training do physicians, or especially cardiologists, ever receive education about the causation of the illness that they have been designated to treat.
Yeah.
And very unfortunate.
Absolutely. And throughout the years of you working on collecting the research on plant-based nutrition and how that can prevent and arrest, prevent and also reverse heart disease, did you meet with much resistance at all? I remember reading in your book that one cardiologist was ready to fire his patient when they wanted to come to you, but instead the patient fired the doctor and came to you for your program.
Yeah, there's always going to be a little bit of an uphill, but it's the challenges in life are what are exciting. And really, I think most cardiologists, basically, over the last 30 years, you can really see quite they're much more open-minded. But although I have resisted saying this for the longest time, I think other colleagues have convinced me that, look, there is an issue of compensation. How much do you suppose you would get paid if you do a bypass operation or if you do stents, as compared to sitting down and talking with the patient about Brussels sprouts and broccoli? Yeah. On the other hand, if you could be equally rewarded for devising a treatment that would halt and reverse their disease, then I think you would suddenly you'd suddenly see this disease be vanquished. Because really, when you think about it, it's really sort of a sorry state of affairs when you cannot look at the newspaper or the television or the radio, when every day you will hear about COVID-19. You absolutely will hear about COVID-19. How many cases are in India? How many are in the UK? How many are in the United States? What's happening to the vaccine? In a little over a year now, we've lost over 600,000 people who've died from that. At the same time, we've had 600,000 people who have been hit with cardiovascular disease, and we look, and what's the reaction to that? It's unfortunate. It's a way of life. Nothing is more crazy. You know, somewhere today, when you've got time, I interrupted my discussion on nitric oxide, and we were going to talk a little bit, I think, about what are the foods that every time they pass your lips, you injure the endothelial cells. Shall I go into that?
Absolutely, please.
First, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells. Do any of you or your patients eat oil? Yeah. Injury to the endothelial cells. That's so fundamental and key. Number two, anything that has a mother or a face, meat, fish, chicken, fowl, turkey, and eggs, and anything that is dairy, milk, cream, butter, cheese, ice cream, yogurt, and sugary drinks, diet colas, Pepsi, Coke, and sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. And I don't like peanuts, peanut butter, nut butters, cashew sauce, or avocado. Finally, coffee with caffeine. Decaf, okay. Coffee with caffeine injures endothelial cells. Now, what are you going to eat? You're going to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, lentils, beans. All these marvelous red, yellow, green, leafy vegetables, and white potatoes, and sweet potatoes, and fruit. And there you pretty much have it. There is one thing that's I think it's important to stress further, and that is the endothelial production of nitric oxide is age dependent. You never heard of a boy or a girl at age 8 have a heart attack, right? They have nitric oxide coming out of their ears. However, by the time you're 50, even if you are beautifully healthy, you're now making 50% of the nitric oxide that you had when you were 25. Now, when you're over 80, you've lost 70% of that nitric oxide production from endothelial cells. So we've done two things that we think are important. We want to try to see if we can't prod or excite the endothelial cells to make more nitric oxide, and at the same time take advantage of the new research in the last 12 years that has shown us that mankind has an alternate pathway for making nitric oxide. So in the last 10 years, we've introduced, for these patients with heart disease, I want them to chew 6 times a day a green leafy vegetable that is roughly half the size of your fist after it has first been boiled or steamed 5.5 to 6 minutes, so it's nice and tender. Then you need to anoint it with several drops of a delightful either balsamic or rice vinegar. Why? Because research has shown us that the acetic acid from those vinegars will help to restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again with a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon is 4, dinner time 5, and of course I adore it when you have that evening snack of arugula and kale. Now, the second benefit that comes from chewing the green leafy vegetable is that it restores the capacity of your bone marrow to once again manufacture the endothelial progenitor cell. What do the endothelial progenitor cells do? The endothelial progenitor cells replace our senescent, injured, worn out endothelial cells. And the third benefit from chewing the green leafy vegetable, and this is the most important. When you are chewing that green leafy vegetable, you are chewing a green nitrate. As you chew this green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue, and those bacteria are going to reduce the nitrate that you were chewing to a nitrite. Now, when you swallow the nitrite, it is your own gastric acid that further reduces the nitrite to more nitric oxide. So think about it. For no added expense, no hideous side effects, absolutely from dawn to dusk, morning to night, all day long, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which has given you this disease in the first place. Now, there's a caveat to this. Toothpaste with fluoride or public drinking water with fluoride or mouthwash will injure those beneficial bacteria in your mouth. And we do not like patients to take antacids because antacids will decrease your gastric acidity. You will not have enough acid to reduce the nitrite to more nitric oxide. Now, what are the green leafy vegetables that I'm talking about? They are bok choy, Swiss chard, kale, collard green, beet greens, mustard green, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. And the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets. And look what it does for your memory.
Absolutely. I wish my memory would be that good. More greens for me. Linda, you're on mute. Thank you for that explanation, Dr. Esselstyn.
Well, it's because the take-home message, if nothing else that your viewers learned today, this disease is caused by your destruction, nobody else's. You have destroyed your endothelial capacity to make nitric oxide. All right? The reason you have the disease, you ran out of nitric oxide. You no longer could protect yourself. All right.
And Dr. Esselstyn, how would you have this discussion with patients without it sounding, because when we talk about cardiovascular disease being a foodborne illness, some people can see that as blame on them, on the individual. So how do you approach this topic sensitively to your patients?
Well, from what I've told you today so far, how would you do it?
By education really, and explanation of the causation.
Ma'am, yeah, if you're going to make a lifestyle change, what is so absolutely important is you must show a patient respect. The only way that I know to show a patient respect is to give them our time. You probably have read in that study of some 200 patients that we had a compliance rate of 89.3, almost 90%. How do we achieve that? By giving them time. What we do now is, even under the COVID rules, once a month, usually for something like 18 or 20 patients, always with their spouse or significant other. This is not a 10 or 15-minute office visit with the patient alone. You have the patient, you have the spouse or significant other. They don't give for 10 or 15 minutes. This is a 5.5-hour day they spend with us. One single day, 5.5 hours. They are going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. They are going to absolutely, every single one of them is going to know that the reason they have their disease is because they have destroyed, through the foods they've eaten, they're going to learn exactly how they have destroyed their endothelium and the foods they must eliminate so they can restore their endothelium and take advantage of the other pathways to regain the molecule they have lost, nitric oxide. And I can tell you, since I'm a little bit old-fashioned, my secretary will give me usually a list 10 days beforehand, a list of who it is who is coming to our seminar. And I will personally call each of them so that I can get my arms around their story and at the same time provide them an opportunity to ask questions of me. So we have really a rather in-depth relationship. My phone call before they ever come to the seminar and then 5.5 hours in the seminar. And how could anybody with cardiovascular disease who has a brain in their head, after they've heard all and learned all this, come up to me and say afterwards, gee, Dr. Esselstyn, that was sure very, very interesting, but Lois and I are going to have our 35th wedding anniversary next week, and boy, am I going to destroy my few remaining endothelial cells. No, doesn't happen. They now are so elated to think that this is disease that is taking them out, killing them. They are empowered to absolutely halt it with delicious food.
I love what you said about giving our patients respect to bring about this conversation, and to give them the respect, we need to give them time. And I work in primary care in the UK, and the system allows me 10 minutes per patient.
That's a horrible system. That is just what you've got to do is you've got to set aside one half day a week, maybe, or something like that, for the panel of patients who have cardiovascular disease, and they deserve the time that it takes to do it right. You're not going to convert people in 10 minutes.
No, absolutely. This is exactly why we've created this platform of afternoon tea, to give us the time to speak.
And what we can do is, as you know, and you're welcome to use any of our materials, but obviously when these patients begin to see the films of those who have reversed their disease, and of course, I should share with you that a part of our intensive seminar for 5.5 hours, near the end of the day, we have one or two local or regional participants who've had a previous successful experience share their story. And there's nothing more powerful, because by now they've learned the science, they've learned the practical aspect of obtaining plant-based foods and preparing them. And then suddenly, here it is. Somebody is right in front of them saying, here is how it works.
This is exactly why we created Afternoon Tea in that setup, where every month is covering a specific disease. And the first 3 Sundays, we talk about the science and educate our patients. And we refer our patients from our hospital, where we don't have time to talk about it, to these educations. And then on the last Sunday, we actually have a patient success story so that they can relate to it. It's the only way that we found an outlet to actually practice medicine the way we believe it should be practiced. And we are so grateful that you said that, because knowing that someone like you thinks it works is incredible. Thank you so much.
Yeah, I don't know why anybody would give that your 10 minutes that you met 10 minutes. You probably hardly even say hello.
Absolutely. Yeah. I don't know what else to say to that, really. It's so true.
Yeah. And actually, I see someone in one of our guests here is Dr. Hans Deal. I was wondering if you would like to come on to say hi. Hans?
Oh yeah, I didn't. Is Hans over in England?
Yeah, no, he's on Zoom. Actually, I just saw him.
Oh no, Hans has been a terrific friend for many years. Hans is a great pioneer and leader in this whole effort as well.
Hello, Hans. Oh, you're just on mute.
I'm on mute? No.
You hear me?
No, sorry.
Yeah, no,
yes, I can hear you now.
I am so excited in seeing not only these 2 ladies who are doing such a devoted job in educating patients and people, but also to seeing my long-standing friend, Dr. Esselstyn. I mean, we have been traveling in Canada, in Australia, in New Zealand, and I am the man that has been very lucky to stand on his shoulders to learn about this special nitric oxide.
Hans, my gosh, you look as handsome as ever. How are you and Lily?
I didn't hear that. Can you say that again, please? You know, I haven't even shaven yet. I just happened to see there's an invitation by Erica and Linda. So I said to my wife, I have to go to a Zoom meeting. She said, don't you shave first? I said, oh, Essie knows me. It's no problem. So it's so good to also see the demonstration of your mental, your memory function to cite all those green veggies. I mean, it's fabulous.
You got to stay with it. You got to keep going.
It's so nice to be listening to you. Thank you so much, Linda and Erica, for inviting me and to listening to my dear friend, a wonderful man for so many years. Thank you.
Thank you so much for coming.
Thanks, Hans.
And your daughter Jane and Annie is doing an amazing job on YouTube. Our patients are loving the illustrations on how to actually make this magic that you are teaching us. It's incredible and really useful for us to be able to just direct our patients to your YouTube channel. And thank you so much. And Jane.
And I actually had a couple more questions that I wanted to ask you. And your initial group of patients that came to you back in 1985, 1986, it seemed like for a lot of them, there was no other options left. And why do you think it's so hard for people to change the way we eat when medications and surgical options are still on the table?
Well, you know, that's such an important and profound question, because when you think about it, we in medicine has really let the population down. We have known for over 100 years. For 100 years, we have known that there are multiple cultures on the planet Earth where cardiovascular disease is virtually unheard of. I mean, if you were a cardiac surgeon and you decided you were going to hang out your shingle in Okinawa, rural China, Central Africa, the Tarahumara Indians in northern Mexico, the Papua Highlanders in New Guinea, you better forget it. You better plan on selling pencils. You're not going to have any heart surgery. It's not there. I mean, why is it so difficult for us to really adopt what those cultures are trying to tell us? I mean, that should be the focus is not to say that you have heart disease because you didn't take a statin drug, or you have heart disease because you didn't have a stent or you didn't have a bypass. That's crazy stuff. Can you imagine another generation from now, how decadent it will be to think that all we did for these poor patients was to give them pills and mechanically intervene on their arteries, which has nothing whatsoever to do with the causation of the illness. You know, there's really been a basic covenant of trust between the caregiver and the patient since the days of Hippocrates, that whenever possible, the caregiver will share with the patient what is the causation of the illness. Sadly, today, in Western medicine, that's not being done.
Yeah, so true, so true. And in my 10 minutes, there's no time to explain the causation, unfortunately, in an adequate way that would allow people to understand and motivate them to make those changes. So do you think that we'll ever win this battle with this toothless paper tiger that is coronary heart disease? Oh yeah, no, I do. Yes, I remain really optimistic that this will happen. Yeah, the change will happen. I mean, as people become, if we can just somehow get this word out, when you think about all of the different media and ways that we have of contacting the public today, I'm just confident that eventually it'll come through. And I know that your father said something that stuck with you, that was that someday we're just going to have to get smarter about showing people how to live healthier lives. So right. Are we getting smarter, do you think? Yes, I think that's the whole basis of it.
Yeah.
Great. Thank you so much, Dr. Esselstyn.
Thank you, ladies.
It's incredible and such a positive note to end on. And just as mentioned before, we will be going off to our 30 minutes with Dr. Esselstyn off camera so that you can ask him questions here on Zoom. So thank you very much for everyone who has come today. Thank you very much for Dr. Esselstyn for this incredible interview and information that you have given us. If you're interested in continuing this conversation off of Zoom, you can become an ATWD member to continue this education and the community. It is all completely free of charge for everyone, and it will always be. We are just here to educate. You can connect with us on Instagram, say hello there on Afternoon Tea with Docs, as well as on Facebook. And you can watch this video on our website as well as on YouTube, where you can subscribe. And next week, if you would like to tune in, we will be speaking to Dr. Michael Clapper. So thank you so much. We're going to stop recording now, and we're going to go off to our informal social event.